Hi, I'm Dr. Stephen Goudy, Pediatric Ear, Nose, and Throat Doctor and Chief Medical Officer of Dr. Knows Best. So the 5 things that you need to know about RSV. Number 1, RSV, a respiratory syncytial virus, is a virus. So it is self-limiting. It will go away. So there's not a need for antibiotics. If your child has a runny nose or a cough and it's not that bad, that's great. It will be self-limiting. You don't need to worry. Number 2, it can cause significant nasal obstruction, nasal blockage, and your child won't eat, won't drink, because they can't breathe, then they can't eat, they can't sleep, they may get dehydrated. So making sure that the nose is clear is vitally important. Number 3, use Tylenol or Motrin depending on your child's age. Make sure it's weight-based to control fevers. So fevers make everybody feel bad, particularly if you are a little baby. It can make you cranky. It can lead to fussiness, not sleeping well, and so on. So depending on your child's age and weight, discuss with your pediatric provider what they can and can't take, and use Tylenol and Motrin alternating every 3 hours if you can to manage the fevers, because when they don't have a fever, they'll feel better, and when they feel better, they'll eat and breathe better. Number 4, make sure that there's good humidity in your child's room. So when there is a virus, both in the nose as well as down in the lungs, if you can't breathe through your nose, you're going to open up your mouth. And again, babies typically have to breathe primarily out of their nose, so they're not really used to breathing out of their mouth. But if they're opening up their mouth and breathing in and out that air, it actually gets really dry down in their lungs and in their airway. So humidification is hugely important, particularly during the winter months when the air in your house is really dry. So have a humidifier adjacent to your baby's crib. Make sure that it's a cool mist, humidifier, warm mist. Humidifiers present a kind of danger to your child, particularly if it's hot and there's water and they pull it over on themselves. That can be quite dangerous. If you look at a model of the face, when the air enters into that nose and goes back here, all of these tissues here are warming and humidifying that air before it goes down into the windpipe there. So if your baby's mouth is open and they're just taking in the air through here, it's not getting nearly the amount of humidification because it's not touching as many of those mucous membranes as it does in the nose. So making sure that there's good humidification in your child's room is really important. And number 5 is really knowing when to go and talk to your pediatric provider. So if your baby is struggling to breathe, if they are having a fast respiratory rate, meaning they're just breathing really fast, or they're using accessory muscles to breathe, then you really want to get to a pediatric provider, an urgent care, or even the emergency room to really be checked out and say, is my baby dehydrated? Do they have pneumonia? Is there need for deep suctioning or what have you, to help your baby breathe and get things sorted out. So if you see them exhibiting any of those signs or symptoms, it's really time to get checked out for RSV or other types of viruses that can cause significant respiratory issues. So those are the 5 things that I think about when I see a baby who has a bad cold, may have RSV. Again, RSV is a virus, but you can test for it at the emergency room, urgent care, or even your pediatrician's office, so that you'll know kind of what to do and what to look out for, but really cleaning out the nose, making sure there's good humidity, and understanding what the signs and symptoms are of significant respiratory concerns are the most important things. And then hopefully a baby will get through it, you'll get through it, and then things will get better. So I hope that this information is helpful for you. Obviously, babies don't come with a handbook, so it can be stressful, but know that as a company, Dr. Knows Best is focused on bringing you evidence-based education that helps you take care of your child and your family.